Hi guys, and welcome again. And today we are going to cover a very funny portion of implementation, and that's use of BNF in OSCE. So BNF currently will be provided with a tablet or an iPad having the BNF app, and you are supposed to use it in case you need it. It's not mandatory. What you need to what I can assure you about the use of BNF is that the time is always limited. That 15 minutes is ever limited, and you might not enjoy using this BNF. What you ought to do is, prior to your OSCE, download the BNF app, get used to it, know how to maneuver the parts in BNF, whereby you go to the search, key in your medication you are not sure with, click it, get the indication, and also get the portion of side effects. You can leave the other portions, but consider the two because that's what you have to provide to the patient prior to administering the medication. So when you have your medication, key it in paracetamol, check the indication so that it aligns with the patient's condition, check the side effects, and with that one you will be good to go. And you should be so quick because the time is limited. Okay, most students are usually not comfortable using BNF, and there is nothing wrong with that because the tension is ever high. What you can do is, if you are not sure, one of the tips that is very, very useful, remember you have to administer at least one medication in OSCE. Even if you are not sure of any other thing, at least administer one medication, because no one will penalize you for not administering medication you are not comfortable with, because patient safety comes first. Should you administer medication that you are not sure of the indication and the side effects, you are down. So what you ought to do is, when you are reading your implementation chart, okay, and you've read it, and you've seen a medication you are not sure with, just tell assessor you'll check it in the BNF. Check that BNF very quickly, few seconds, then get back to assessor, tell them that you've checked the BNF, but you are still not happy with the details of the medication. You will have to seek further clearance from the assessor, from the prescriber. So you will code it as 2 to mean you've omitted it for clinical reasons, and the reason would be I need further clearance from the prescriber. Okay, with that one you would have covered yourself, and you would have also ensured you've managed your time within the expected period. That is for the BNF, and that's the surest way of covering yourself for that case. Otherwise, you can waste a lot of time checking your BNF until you miss the actual provision of medication to the patient, which is very, very key. At the same time, there are also the old BNF books. Okay, these are not very common, but what you need to know, the medications are not usually in order. So for you to get the medication, you have to go at the back page of the book, check the index number of the medication, check the page number is when you go to the page, because they are not arranged in any order. Those are the things you need to consider for BNF. But remember the tip, because it could be helpful. While going for your OSCE, always get prepared to use it, and also to know how to maneuver around in case you are not able to use it. With that one, you will be good to go, and you will be able to manage time. Otherwise, don't administer any medication if you are not sure of the indication or the side effects. Provided you can't tell the patient, just know from the back of your mind you can be able to code it, but you can't code everything. You have to administer at least one medication. Thank you so much, and see you next time. Kindly subscribe to my channel, and let's do this. Go pass your OSCE, because with that one That's always the surest way of moving forward to your band 5. Thank you so much, and let me see you next time. Bye.